Hi there, and welcome to this discussion about the relationship between gut health and whole body wellness. This will be informative if you're looking for answers on specific problems you know you have related to gut health, but also if you're looking for information that can help you prevent problems in the future. In the next few minutes, we're going to do a high-altitude overview of digestion and gut health related to their fundamental role in wellness and healing. We'll talk broadly about the problem, the causes, and some solutions to get an understanding of the main things to consider in any wellness or recovery program. Our main goal is to encourage you to embrace a more cause-related model for understanding your health rather than a reactive one of symptom control or modification. I'm Dr. Tim Chrisman, a functional nutritionist and chiropractor in private practice in Dallas, Texas. This is the first of regular health-related content that I'll be sharing, so I hope you stick around and plug into the coming resources. But first, the obligatory disclaimer. Nothing I say here should be misconstrued or inferred as medical advice or as a replacement for medical consultation. This information is for educational purposes only, to be applied at your own risk. Please seek out the help of a medical professional for any medical condition or concern. The problem we're discussing here today is that digestive disorders are rampant in the United States. They're one of the biggest challenges to our healthcare system, and they're intertwined with a large percentage of other health conditions. They also frequently go undiagnosed, so there are a ton of people suffering in silence or don't even know they have a problem to start with. They can be subclinical and without overt symptoms and can be very resistant to conventional treatment. You might be surprised to know that even cardiovascular disease, cancer, and diabetes, as well as allergies, inflammation, and autoimmune conditions, are heavily influenced by gut health. Skin conditions frequently reflect what's happening on the inside of the gut because skin develops from the same original tissue as the gut lining. There's such a strong connection there that what happens in the gut sometimes manifests in the skin as well. These source cells are called epithelial tissue. When you begin as an embryo in the womb, these epithelial cells differentiate into different tissues and organs in the body, but they continue to share some of the same main functions. This epithelial tissue becomes the covering of all internal and external surfaces of the body. It lines body cavities and hollow organs, and is the major tissue in glands. And depending on where it is in the body, it has a variety of functions, including protection, secretion, or absorption. So you sweat, secrete hormones, absorb nutrients, and form a barrier in the skin and the gut that does its best to keep foreign invaders outside the body. It's usually quite a surprising realization to people that the inside surface of the gut, from the mouth to the other end, is actually outside the body. It's the outside inside, so to speak. And you can see how that covers a ton of territory when we're talking about the relationship of the gut to other problems. To put a point on it, when it's not a direct cause, the gut is a contributing influence to just about everything we experience. Understanding the actual drivers of gut and digestive disorders is crucial for generating well-being and longevity. These drivers or causes can create a massive drain on the body's energy production and the immune and repair systems. So the old saying is that you are what you eat, and that works. If you eat junk, you're going to get junk out of your body, but it's a little simplistic. In these days of industrialized food, toxins, and resistant infections, it's actually more accurate to say you are what you absorb, and you are what your food ate, meaning you are the chemical cocktail of how your food was raised and processed. We'll get to more about that in a minute when we get to the 6 main causes of gut issues. But to expose the weight of the situation, here are some alarming facts from the CDC in the last few years. 14.8 million people have ulcers, 35.4 million physician visits result in a diagnosis of digestive disorder of some sort. 8.4 million emergency room visits result in a primary diagnosis of digestive disorder, and somewhere between 25 and 45 million people have IBS. That's a huge range, but a lot of people, like we said, don't know they have a problem. There's a potentially vast unknown number of people that are undiagnosed, simply don't know their body's not living up to its potential. So literally more than 10% of the population may have IBS, and this doesn't even include several other gut diseases like celiac or Crohn's or others. IBS is a functional condition, not a disease per se, that can be overcome by doing things to promote balance and proper function. Conventional treatment with prescriptions or over-the-counter meds doesn't typically resolve this because people with IBS are already suffering from chemical problems. Pretty hard to fix toxicity with another toxin. So medication can help temporarily, but everywhere there's a symptom being controlled or hidden by medication, there's an underlying problem not getting fixed. Eliminating the cause is essential, but there seems to be a disconnect in the collective consciousness about this nuance. I can't tell you how many people have told me, oh, I don't suffer with that anymore, or I don't have that problem anymore. And I ask them if they're still taking meds for it, and they say yes, they are. They think they're better symptomatically actually, but they're still on medication to control or subdue symptoms, potentially for the rest of their lives. So the major premise we're getting to here is when we use natural and healthy means to eliminate the causes and promote proper function, not only can we repair the gut, we can literally build stronger people who heal, have strong immune systems, and don't get taken down so easily by every stressor that comes along. Making your gut health a priority can give you back your ability to adapt and fight and prevent disease. So I've mentioned causes a couple of times, and we're going to discuss those now. There's 6 major categories, and we're going to outline those here and then eventually expand on all this in future content. And here they are. Number 1 is infection. Think bacteria, fungal infections, and viruses. Number 2, infestation, or better known as parasites. These are physically visible worms or microscopic to the point of living inside your cells. Number 3 is toxicity. We have 3 main sources of toxins: outside chemicals, waste from our own cells, and waste from unwanted visitors. We can have difficulty detoxifying any of this when our normal systems are overwhelmed. And those would be liver, kidneys, lungs, skin, colon, etc. Trauma is number 4, trauma of all types, acute or chronic, emotional, physical, any type of stress that overcomes someone's innate adaptive ability. Number 5 is nutrient depletions and deficiencies. Number 6, last but not least, nerve interference. And this is a big one because all of the above causes can create interference in the nerve system that can affect literally anything else in the body. The technical term for this is viscerosomatic, basically organs affecting the soma or the body, and the nervous system orchestrates all of that. Examples of this would be a congested liver from possibly a combination of toxins and infection, causing a stiff right shoulder or neck, and maybe there's inflammation in the colon caused by a parasite that precipitates a chain of events that lock up the pelvis and the hip joints, create low back pain, or potentially even sciatica and other conditions. Seen from this vantage point, you can even understand how these underlying causes could be responsible for joint degeneration and even a hip replacement, or after decades of chronic inflammation. So in our conventional approach, we sometimes fail to answer the question of why some people have more degeneration than others. Frequently, we mistake the symptom as the condition, but in doing so, we completely ignore the cause. And then as far as our application of healthcare is concerned, we view those types of problems as purely mechanical or orthopedic, rarely acknowledging that there could be something deeper at play. In other words, we don't ask why enough to get to the root of the problem. We just think of it as something to do therapy or adjustments or surgery on, which is a surface level treatment very frequently. And as a licensed chiropractor, I find some people can hold their adjustments longer than others. This isn't simply a reflection on the quality of the chiropractic adjustment, but it's a perfect example of how the biological burden someone's dealing with can influence structural and mechanical integrity of the body. And this biological burden from all the causes that we just mentioned is probably the largest determinant of aging, longevity, and disease development. So those are our broad categories of causes. I want you to notice I didn't include genetics in the mix. Genetic diseases do exist. They're a very small percentage of the overall picture, and we're realizing we have a lot more power over our genetic expression than we previously thought. Also, the health problems we're really talking about addressing in the natural or holistic healthcare are not generally genetic disorders with chromosomal abnormalities. Instead, we're talking about gene expression. We may have a genetic predisposition for something, but it never expresses itself as a disease. If you want to go down a rabbit hole on that topic, start looking at the topic of epigenetics, which is the study of how organisms can change by changing gene expression rather than altering the code itself. The research that's currently being done is demonstrating that one particular gene could potentially express itself in a multiplicity of different ways, and that this expression model of genetics indicates each gene can have an on or off switch and volume control depending on what's happening in the cell. This is definitely empowering for a vitalistic and health-based model of care, but getting back to our main topic, there's a nuance about symptoms that's important to point out here. Symptoms are just signs. Most short-lived ones are normal and occur because the body's trying to fight off an infection or deal with something, for example. But if they stick around for a long time or they're suppressed by medication for a long time, there's obviously something wrong that's not being addressed. The body's trying to tell us something and we should listen rather than trying to hide the message with chemicals. That's literally like putting tape over your check engine light with smoke coming from underneath the hood. So with that said, even acute infections of the gut like food poisoning can become asymptomatic and go undercover after treatment and leave us more vulnerable to other opportunistic bugs getting into the system because they limit the normal protective functions of the body and they hide. If I had $1 for every time a patient said that it was some weird thing they caught in another country years ago that started all their gut issues, I'd be a rich man. Every insult that's not completely eradicated can potentially affect the body's defense mechanisms. Your particular problems may have started years ago after that trip to the Caribbean when you got sick, but have turned into chronic problems that may not resemble the original infection. We can add insult to injury then with modern industrialized foods, sugar and alcohol. I'm not just talking about candy and preservatives here, because some of the worst food problems come less from the actual food choices and more from modern farming and processing methods of normal, healthy, traditional foods. People are starting to understand that foods like beef, wheat, and beans have been raised or grown and processed in such a bad way that by the time we get them to our table, they're basically loaded with chemicals, anti-nutrients, and bad fats. Anti-nutrients inhibit the absorption of vitamins and minerals, literally binding them up as we eat them so that they're not available to us. And then fatty acid imbalances go downstream in our biochemistry to create inflammation. If too many nutrients are inhibited from getting into our blood and tissues, it means deficiency down the road, depending on how long it's been happening, possibly even pathology. It's easy to believe that traditional foods that we commonly eat are all normal and pretty good for us, but this goes back to what I said before. You're not eating just plain food, you're eating what it ate and how it was treated. In this light, both animal and plant foods each present different problems to us, and it's beyond the scope of this talk to get into all the details. Hopefully we've covered some ground here in the right direction. Food needs to be raised properly in a healthy way and then prepared and cooked in a fashion that allows for maximum retention of vital nutrients. So again, we'll cover more of these details in future content, and I hope you'll stick around, subscribe, and share this with someone you care about. We've already hinted at some solutions, but it's a little more involved than simply eating perfect food. It can be exceedingly difficult to eat perfectly, not to mention what's perfect for one person isn't necessarily perfect for another. There's so much good and bad information out there about how we should be eating. There's some basic principles that hold true for all people, of course, but the devil's in the details, and the devil's in your own personal chemistry and makeup. In getting rid of a problem like IBS or an ulcer, you first have to know which particular challenges are causing it. An ulcer is for sure not just caused by an imbalanced diet. You need a way to define all those influences, prioritize them, and then find the best remedies for each. Some of the remedies are in the grocery store, granted, but many will definitely need something more dynamic and comprehensive. To define the things we're up against, we can use traditional or functional lab testing. One example is the GI map test. It's just a test that quantitatively assesses a surprising variety of organisms. Kinesiological or muscle testing is a technique used by a lot of alternative practitioners with amazing results. It can find things that are undetectable to traditional labs because it works on more of an energetic level with the nervous system, and it doesn't depend on being able to see the evidence with a microscope or in a laboratory chemical solution. It's also a lot more cost-effective than expensive lab tests. Because one of these routes doesn't necessarily replace another, it's good to use a combination approach. Once we know what elements are present, if bacteria, parasites, or cellular waste toxins are present, for example, we can find natural remedies such as dietary guidelines, whole foods, supplements, botanical herbs, homeopathics even, that can help us correct function, detoxify, and help the body eliminate the unwanted hitchhikers. Dealing with these as they crop up over time can help your body maximize health and function, get you back to feeling great and doing all the things that you love. Nothing worse than feeling like trash, always needing to know where the nearest bathroom is, or not being free to do what you want. So hopefully I've answered some fundamental questions here, but if you're at the beginning of this journey, You probably have a lot more questions now than before. As I said earlier, we'll continue addressing the ins and outs in future content. And I'll be dropping videos on a regular basis, and I'd love to have feedback on what your main health interests and questions are. I hope you stay tuned and subscribe. Feel free to hit the little bell for notifications to stay current on what's happening on the channel. And I'll see you soon.